Hey everyone, welcome back to Corporate Decoder, the place where we try to make sense of the money-making world without putting you to sleep. And today we are diving into some exciting news from Senti Biosciences Incorporated, which is a company looking to revolutionize cancer treatment with a really cool technology that sounds like something out of science fiction. So what is this big announcement? Well, Senti Biosciences Incorporated is sharing some very early but promising results from a clinical trial for a new cancer therapy called Senti -202. Now this is a big deal because it involves a special type of cell therapy and it has been recognized by the FDA with a special designation. Let's break down what that long name means. Imagine your body's own natural killer immune cells, but then supercharged and programmed to find and destroy cancer cells. That is essentially what this therapy is trying to do. It is designed to target specific markers on cancer cells, sort of like a lock and key mechanism, to make sure it only attacks the bad guys and leaves your healthy cells alone. This is particularly important for certain types of blood cancers like acute myeloid leukemia, also known as AML. And here is where it gets even more exciting. The US Food and Drug Administration, or FDA, has given Senti Biosciences Incorporated Senti -202 a regenerative medicine advanced therapy designation. Think of it like a fast pass for promising new medicines that could treat serious or life-threatening diseases. This designation means the FDA recognizes the potential of this therapy and will work closely with the company to speed up its development and review process. This is a huge vote of confidence and shows that Senti -202 is something to watch in the world of cancer treatment. Now, of course, these are early days. What we're seeing here is initial data from a phase 1 clinical trial. Phase 1 trials are primarily about safety and dosage to make sure the treatment is safe for people to receive. While they also look for early signs of effectiveness, the main goal is to test the waters safely before moving on to larger trials. So while the results are encouraging, it is important to remember that this is just the first step in a long journey for any new drug. The therapy is being tested on patients with relapsed or refractory hematologic malignancies. This means patients whose cancers have come back after initial treatment or have not responded to other therapies. These are often the toughest cases to treat. So any progress here is incredibly significant and offers a glimmer of hope to those who need it most. The specifics of how Senti -202 works are quite impressive. It is engineered to actively seek out and eliminate cancer cells that express certain markers, specifically CD33 and FLT3. These are important targets in several types of blood cancers, especially AML. By precisely targeting these markers, the aim is to maximize the destruction of cancer cells while minimizing damage to healthy bone marrow cells, which is a common challenge with some other cancer treatments. It is worth noting that Senti Biosciences Incorporated is a publicly traded company under the ticker symbol SENTI on the Nasdaq Capital Market. This means investors can buy and sell shares of the company. While this report doesn't dive deep into the company's financials in terms of revenue or profit for this specific filing, the RMAT designation and positive early trial data can certainly impact investor sentiment and the company's market valuation. Now, like most companies in this field, you'll see a lot of language about forward-looking statements. This is standard legal sire. Basically, they are saying that their hopes and expectations for the future, like when they might have more data, or if their drugs will work as well as they predict, are just that, hopes and predictions. They are based on current beliefs but aren't guarantees because the future of drug development is full of unknowns, risks, and uncertainties. It is a good reminder to always be a bit skeptical of overly optimistic pronouncements and to remember that actual results can and often do differ from what companies hope for. They also mention specific filings from 2024 and 2025, which give a broader picture of their financial health and risks. The core of this update comes from a press release issued on the 9th of December 2025. This is the official announcement to the world about their progress. It is accompanied by a slide presentation, also dated the 9th of December 2025. These documents are attached as exhibits to the filing, meaning they are part of the official record. What is my take on all this? Well, Senti Biosciences Incorporated is definitely in an exciting but high-risk, high-reward space. The RMAT designation for Senti -202 is a significant validation from a major regulatory body, which can accelerate development and attract further investment. The underlying science of precisely targeting cancer cells with advanced immune therapies is where a lot of innovation is happening. However, the road from early clinical trials to a fully approved and widely available drug is long, expensive, and fraught with potential setbacks. Many promising therapies falter in later stages. The biggest opportunity for Senti Biosciences Incorporated is clearly a successful development and approval of Senti -202 as a novel and effective treatment for difficult-to-treat blood cancers. This could not only save lives, but also position them as a leader in the burgeoning field of cell-based cancer therapies. The risks are substantial. The therapy might prove not to be safe enough in larger trials, it might not be as effective as hoped, or it could face significant competition from other companies developing similar or alternative treatments. The forward-looking statement section is a stark reminder of the inherent uncertainties in this industry. For investors and observers, the key things to watch will be the continued progress in their clinical trials, especially the safety and efficacy data emerging from phase 2 and phase 3 studies, and how they manage their cash burn as developing these therapies is incredibly resource intensive. Alright, that wraps up our look at Senti Biosciences Incorporated's latest update. What do you think about the potential of Senti -202 in the RMAT designation? Let us know your thoughts in the comments below. If you found this breakdown helpful, give us a thumbs up and subscribe for more deep dives into corporate filings. And hey, if you want to connect with other like-minded individuals and discuss these topics further, our Discord community is linked in the description. See you in the next video.